Bismillahirrahmanirrahim. Assalamualaikum and very good morning to everyone. Welcome to UMHealth breakfast at UMHealth. UMHealth. My name is Adina from the Department of Primary Care Medicine. I am here to introduce the first speaker, which is Dr. Nurdiana Abdullah. We can be sisters, but we're not. She is a family medicine specialist and a senior lecturer at our department of Primary Care Medicine. She is actually trained in for her medical degree, MBBS, as well as the master's program. She had worked in the Ministry of Health for many years and has held a senior position in the Selangor FMS groups. She then kindly joined us a few years back. We are so happy to have her with us, and her interest, her research interest mainly is in health behavior, preventive care, and non-communicable disease. Today, the title of her talk is Doctor Heal Yourself. She's going to go through the idea of doctors self-diagnosing and self-treating themselves. There are many reasons why we do this. Some include convenience. Maybe we think we only have mild disease and we are familiar with the treatment. However, there are issues that she will raise in her talk that may compromise clinical objectivity, lead to over-treatment or even under-treatment, and maybe treating beyond one's clinical competency. Ethical implications and the appropriateness of doctors treating themselves will be discussed in her talk as well. So Dr. Diana, the floor is yours.
Bismillahirrahmanirrahim. Okay, Assalamualaikum and very good morning. Thank you very much, Prof. Adina, for the very kind introduction. So my topic today, which I will present, is entitled Doctor Heal Yourself. So I will start my to share screen. Okay. As an introduction, I will highlight two anecdotal cases. Both are about doctors, and both are actually working in a primary care setting. So the first case is about a 50-year-old male doctor who is a general practitioner in private practice. So his practice is he routinely will do a screening blood test yearly at a private lab, and he will normally review his results himself. So about 2 years ago, he noticed that on his routine screening, he noticed that his fasting blood sugar and his HbA1c was raised, and he self-diagnosed with type 2 diabetes mellitus. So he started himself with oral hypoglycemic agent, that is metformin. And he will continue monitoring himself, yearly blood tests, monitor his glycemic control. He will also control his diet and exercise by himself. So far, he is happy with his own treatment. As according to him, his HbA1c, he managed to maintain it around 7%, which he feels is a very good control. Right. The other case is about a 43-year-old female doctor who is also working in a primary care clinic. So her problem is she has been having episodes of itchy rash over the lower limbs, actually for the past 3 to 4 years. And she self-diagnosed her condition as eczema, and self-treat with betamethasone cream, which is Betnovate cream, and Aqueous cream. So she was happy because each time she treated herself, there was improvement. However, the symptoms will intermittently recur. which was okay with her because that is the natural history of eczema. However, for the past 1 month, she had the similar rash on the upper and lower limbs and also at the forehead, and it did not improve with the usual self-treatment. So she self-referred herself to a dermatologist who diagnosed her condition as seborrheic dermatitis, and her symptoms actually improved with the treatment by the dermatologist, which was ketoconazole shampoo, mometasone cream, and aqueous cream. Okay, so these two cases highlight what I think many of us have also treated ourselves sometime in our career, whether maybe when we had fever and cough, sore throat, maybe we had experience in getting ourselves medicine, treating ourselves, and so on. Of course, during the COVID-19 pandemic, you can see in the internet such stories like this doctor who treat himself actually with zinc and hydroxychloroquine, which he believed is beneficial for COVID-19. And he actually got better, so he had a good outcome. All right. So talking about doctor self-treating themselves. So we have to know what is actually self-treatment. By definition, it is medicating oneself or treating one's own disease without any medical supervision or intervention. And our renowned physician, Sir William Osler, had said that a physician who treats himself has a fool for a patient. So whether you agree with this statement or not, we shall see. Okay, so is it a common thing, doctors are self-treating themselves? So self-treatment can be considered like you review yourself, your symptoms, you self-diagnose, you investigate yourself, review the results yourself, and also provide medication for yourself. Okay, so Montgomery has done a systematic review, but it was way back in 2011. He included studies which looked at physicians and medical students' behavior in self-treatment. And the included studies were mainly from US, European countries, Australia, New Zealand, and Hong Kong. And he found that in about 76% of all the included studies, reported self-treatment was more than 50% among either the physicians or medical students. So you can see that even from the stage of medical student, we do already start self-treatment as long as the medication we were easily access to medication. So looking at 23 of the included studies, the mean number of physicians practice self-prescription is about 61%, which is the mean. The range can differ from as low as 9% or as high as 99%. All right, so what about more recent studies? Is there any changes? So one study by Hartnett et al. In 2020, who did an online survey among 729 doctors in Ireland. And he found that 66.8% reported that they had self-prescribed before. So looking at the common medicine self-prescribed by doctors in this study, so of concern are actually antibiotics, about 62.5%. And among the female respondents, most commonly are contraceptive For example, oral contraceptive pills. This is about 59.9%. Also, another concerning thing, although it is not as common as antibiotics, other medications like benzodiazepine or hypnotic, about 7.2%, and opioid pain relief, 4.5%. She also found that 63.9% of the respondents actually had registered with a GP. However, this did not predict whether a doctor self-prescribed or not. So it's regardless whether they had their own family doctor or not. Another study which is nearer to us, which is done in India, although this is a smaller number of respondents, about 184 doctors. And it was found that about 95.7% of male doctors and 97.8% of female doctors actually self-prescribe. So this is a very high number. However, looking at the common illness for prescribing in this study, so most of them self-prescribe if they have problems like headache, that is 78.7%, or cough, cold, or sore throat, 79.8%, and pain syndromes, various pain syndromes, about 31.5%. And the common medicine self-prescribed in this study conducted in India were analgesics, 80.9%, and antipyretics. So it is a bit different from what was found in the study also in 2020 in Ireland. So in India, it's more of headache, cough and cold, and they self-prescribe analgesic and antipyretics. So do we know anything about how it is in Malaysia? There was a study, it was done way back in 2012, and it was conducted among 85 Malaysian healthcare professionals at AIMS University. And these healthcare professionals included medical professionals, dentists, and also pharmacists. It was found that overall 77.6% of healthcare professionals in this study self-prescribed. And among medical professionals, about 86.5%, 70% among dentists and pharmacists. So you can also notice that self-treatment or self-prescribing actually is not limited only among doctors. Even dentists or pharmacists, they also some of them also practice self-treatment or self-prescribing. And the common illness for self-prescribing was found to be headache and cough and cold. So it's kind of similar with the what was found among the doctors in India. Similarly, also common medicine self-prescribed in the study was analgesics or antipyretics. Okay, so it is. You can see that it's quite common, and I think if we think about ourselves, we had self-treat or self-prescribe ourselves sometime in our career, right? So what are the reasons for self-treatment among doctors? So some of them is about convenience. Doctors, we are so busy, we don't have the time to make an appointment to see another doctor when we are sick. And also by self-treatment, it is something which is a time-saving and cost-saving, especially if we are working in a private practice. We don't have to take time off away from our patients to see another doctor. And also we can sort of save costs if we are in a private practice. And also as doctors, we are always working. We always feel pressure to remain at work because always our priority is our patients, right? And some do feel that by treating ourselves, we will sort of help to reduce strain on the already hectic healthcare system, uh, avoiding the crowd in another clinic and so on. Of course, some will feel that as doctors, we already have the knowledge to treat certain health conditions or illness. We have that confidence. So if we have the knowledge to treat patients, uh, of course, we can use the same knowledge to treat ourselves, right? And another thing is, of course, our ease of access to medicines, and this also contribute to probably why this also occur in other healthcare professionals like dentists, of pharmacists, or even among medical students. Uh, of course, many doctors would believe that treating ourselves, there is no harm in that. Um, there is nothing wrong with that. So, with that belief, then it is sometimes like a culture among doctors to treat ourselves. Uh, and another thing about doctors, because our role in treating patients, uh, so it's quite common for us doctors to be very reluctant to have our role reversed. That is, now we are the patient, so there is always the reluctance. And of course, some will also be concerned about other issues like confidentiality. If I go and see my colleague about my medical condition, will there still be confidentiality? Will my other colleagues know about it? And of course, talking about the culture of self-treatment among doctors. So we do tend to accept that doctors, we can self-treat, and it is a norm. Okay, so having said that, are there any uh, other ethical or practical implications if we self-treat? So among them are uh, among the implications, firstly, this can compromise our clinical objectivity. I mean, uh, it's difficult for us to see ourselves as a patient. So it may lead to incomplete assessments, medical errors, like misdiagnosis, and this actually will impair the quality of care for our own health. The other thing is compromise the continuity of care. So it has been shown that continuity of care is something which is beneficial to patients. Especially with patients with chronic diseases. So if we as doctors, we treat ourselves, the treatment will not be documented anywhere. And if we have our own regular doctor or family doctor, he or she may not be aware of our treatment, and he or she may not be aware of the whatever information which may be relevant for our future follow-up. So this is also will compromise our own health and our own quality of care, actually. Uh, and thirdly, uh, sometimes we tend to treat beyond our own expertise. So we have the inclination to treat beyond our own skills or knowledge, because we normally will feel confident. We overestimate our own ability. We always think that, oh, okay, I used to work in that department, so I know about it. But we might not be aware of the updates in treatment and so on. The other thing is also the risk of over or under treatment, which is also related to our compromised clinical judgment. So either we always want to prescribe the best for ourselves, even though the medication is not clinically indicated, and this can lead to other problems like adverse reactions to unnecessary medication. Or we can also tend to minimize our own clinical condition. Therefore, this will lead into not receiving appropriate treatment required for that condition. Of course, the other concern is it may also lead to abuse of certain medications like benzodiazepines or opiates, using medications which we prescribe inappropriately for a long period of time or inappropriate dosages. Okay, so after looking at all the implications, uh, is there a position on self-treatment after considering all the pitfalls with self-treatment? So there are actually various guidelines by various medical councils which actually caution against it. But what if a doctor has minor symptoms or illness? So we always encourage or empower our patients to do self-care, or if they have a minor illness like minor cough and cold, to try and take over-the-counter medicine first. So where do we draw the line between self-care and self-treatment? So looking at the various guidelines, like in the United Kingdom, it was stated in their good medical practice that in providing clinical care, you must, wherever possible, avoid providing medical care to yourself or anyone with whom you have a close personal relationship. That is like your family members and so on. So it's a clear statement there. And if you prescribe any medicine for yourself or someone close to you, you must make a clear record at the same time or as soon as possible afterwards. The record should include your relationship to the patient if you are prescribing to a family member. And also the reason it was necessary for you to prescribe. And it also states that avoid self-diagnosis and self-management for anything other than minor ailments. So it gives some leeway about minor ailments. And another point brought up for the UK guide, you must not prescribe controlled drugs for yourself or someone close to you unless no other person with the legal right to prescribe is available to access and prescribe without a delay. And also if it is an emergency treatment, which is immediately necessary to avoid serious deterioration in health or serious harm. Okay, so in terms of controlled drugs, it is more strict in terms of the guide. So what about the other code of ethics, like in USA? Similarly, it was stated that physicians should not treat themselves or members of their own family except in limited circumstances. For example, in emergency settings or isolated settings when there is no other qualified physician, or for short-term minor problems. Okay, so it was for many guide, it was not stated what constitute minor condition. However, in the New Zealand Medical Council, it has given a definition. A minor condition is a condition which is non-urgent, non-serious, that requires only short-term episodic routine care. So it is something which is not likely to lead to a more serious, complex or chronic condition. And the New Zealand Medical Council's definition, it did not consider a complex or chronic condition as a minor condition, even where their management may be episodic in nature. Okay, so for Australia, also similar. It states that all medical practitioners should have their own independent GP, and medical practitioners should not initiate treatment, including prescribing for themselves or members of their family. So except in emergency situations or isolated settings when there is no help available. Then they may treat themselves or members of their family until another medical practitioner becomes available. It is also similar in the New Zealand guide, that you should not provide care to yourself except in limited situations. And there is certain situations where you must not provide care to yourself at all, like prescribing or administering medication with a risk of addiction, or prescribing psychotropic or controlled drugs, issuing repeat prescriptions where you are unable to review whether the prescription is suitable, conducting psychotherapy, issuing medical certificates, conducting medical assessments for a third party, and performing invasive procedures. So you notice that for the Australia and New Zealand Council guide, it did not give treating a minor illness as something which you can self-treat, differing from the US or UK guide. There are limited exceptions to this rule, including emergency situations or in particular communities where access to other practitioners is difficult. So in these instances, ensure that your care is consistent with acceptable clinical and ethical standards. All right. Actually, they have taken doctors who self-prescribe in this example, who self-prescribe controlled drugs to disciplinary action. And for nearer to Malaysia, Singapore Ethical Code and Ethical Guidelines is a bit different. Essentially, it forbids doctors to treat themselves and those close to them for controlled drugs with significant potential for dependence and psychiatric care. However, Singapore guidelines are more lenient. It states that generally you may provide care to yourself and those close to you when it is for routine continued care for stable conditions, minor conditions, or in an urgent emergency situation when no other suitable doctors is available in a timely manner. So it provides leeway that you can provide care to yourself when it is a routine continued care for stable conditions, which is different from the other countries' guidelines. And even regarding surgery to your family members, if you choose to provide significant care such as major surgery to those close to you, you must ensure that your objectivity, judgment, and professionalism in medical decision making are not compromised. What about Malaysia? Actually, from my knowledge, going through our good clinical practice and code of medical ethics, unfortunately, there is no statement on self-treatment and self-prescribing. What can we conclude that? So we can see that self-treatment among doctors are common, and it is not something unusual. After looking at all the implications of self-treatment, I can see that the risks outweigh the benefits of self-treatment. And as doctors who strive to provide the best for patients, we have to ensure that we have the best treatment for ourselves. That is by being cared by an independent doctor rather than we treat ourselves, considering all the implications of self-treatment. And a self-treatment, if any, should be restricted only for minor short-term illnesses or emergency situation where no other doctors is accessible. All right, so with this, thank you very much for listening. These are all my references.
Thank you very much, Dr. Diana. That was a very comprehensive review of what recommendations there are out there with regards to doctors treating themselves. We have a few very good questions. So I will start with these questions. The first question from Prof. Chan asks, did the studies that you mentioned earlier, Dr. Diana, studied the relationship between the ease of getting the medication, meaning if the pharmacy are easily dispensing them, and the behavior of self-treatment by doctor?
Okay, so the studies which I showed did not actually look into this relationship, I'm afraid. But there are previous opinion and so on that this is probably one of the reason why doctors self-prescribe.
Okay. Yeah, I think that is going to be interesting because in countries where there are stricter rules, there seem to there might be stricter rules in terms of getting drugs from the pharmacy, I think, yeah. But doctors can still prescribe for themselves. And if we don't have a strict rule for pharmacy to say, is this you that prescribe this medicine for yourself, then I think that can easily be circumvented as well. The next question is on, is there a study or that report on the percentage of self-treatment in non-medical population, meaning public
patients?
Patients,
Actually, there are many studies which look at self-treatment among the population, among patients. I don't have the figures there on the percentage, and the studies may look into different aspects of self-treatment, like self-treatment for a certain particular conditions. But yes, to answer the question, there are many studies published about self-treatment among patients. Unfortunately, I don't have the figures
do you think it's
compare
higher?
with
I think there seems to be an idea that it's higher than in medical in the medical population or profession. Do you think it's higher?
Well, it might, of my opinion, it might not be, except if they look into self-medicating with over-the-counter medicine. It might be higher. Because it's easily accessible to patients. If other prescription medicine, it is not easily accessible to patients, so it might not be as high as self-prescribing this kind of medicine among doctors.
I see. And I think in your talk, your main focus is actually on the controlled medicine that needs to be prescribed, right, Dr. Diana?
Basically, the overall self-prescribing medicine. But I highlight about controlled medicine because it does happen among doctors, even though the prevalence is low.
All right. Okay, so just two more comments, and then we can close this first talk and go on to the second talk. So the two comments are a meaningful study. A suggestion for a study would be to look at self-treatment for chronic illness, such as diabetes or hypertension, and comparison between the medical and non-medical population. The next comment said that, because even lay public self-prescribe, and sometimes they even tell doctors what to prescribe for them and like insisting for antibiotics. So it seems to be a cultural thing. It seems to be something that we in Malaysia, medical or non-medical tends to do. We tend to try and find the answers ourselves. Thanks a lot, Dr. Diana, for that wonderful talk. I now